Hello, everyone. Welcome to council session today. You have the agenda in front of you. I'd like a motion to approve the agenda. A motion to approve the agenda. It's moved by Councillor Kerr, second. By Councillor Bourne. All in favor? Carried. Approval of the April 14th, 2025 council minutes. Can I get a motion to approve those minutes? It's moved by Councillor Matheson-LeFort. Do I get a second? Second by Councillor Hennick. All in favor? Motion carried. So today we have presentations. We have 3 presentations. The first one being the Nova Scotia Health Authority. I'm going to allow questions from council first, and then we'll get questions from the public. 10 minutes, that's what we have. And I have to remind people, there's a microphone right there at the end. You come up, you state your name and ask your question, and there's a little button on there, and it has to be on the green so people can hear you. And it's not only the people in this room, it's so our public can hear you. You have 20 minutes for your presentation. And welcome, Brett. If you want to introduce everybody else with you, that would be great. Thank you.
I will. Thank you, Warden. Thank you, Council, and to the community members that are joining. My name is Brett McDougall. I'm the Vice President of Operations for Eastern Zone for Nova Scotia Health. With me today, with me today is Glenn Cox. He's the Executive Director of Rural Health for Eastern Zone for Nova Scotia Health. Also, Andrew Heighton, who's the Director, specific responsibility for the facilities with Nova Scotia Health and Eastern Zone. And we have Megan Morrison, who's the site lead for the Baddeck facility. And we also have Lynn Gilbert, who is with us from a comms or communications perspective. Dr. Don Bryan sends his regrets. He's in doing surgery today and couldn't afford the time to come with those commitments. So we'll start out. We'll give an overview of the Niels Harbor Buchanan Memorial Facility. Then we'll move to Victoria County facility in Baddeck, and then we'll open it up to questions, and or if there's anything else that's specific to people, then we can provide answers. Okay.
Like myself, a little louder.
Do you want me to start over? No? Okay.
Okay, good morning. As Brett mentioned, we're going to start off with a quick overview of Buchanan Memorial or Community Healthcare Center, so up in Niels Harbor. So with Buchanan Memorial Hospital, it is a 10-bed level 4 ED with approximately 65 plus staff members, and that's inclusive of all levels of staff, nursing, dietary, community health, etc. Up currently in Niels Harbor, we have 2 physicians. Both physicians work 0.75 each, so totaling a 1.5 FTE, covering primary care, inpatient coverage, and emerge, leaving currently 2 to 3 vacant physician positions that are currently being recruited. We have a nurse prescriber that works in acute care and ambulatory care. We also have a nurse prescriber that's enrolled in the program currently, and which will be able to, once she's graduated, support through ambulatory care, emerge, and primary care. Ongoing recruitment for physicians, locums, and opportunities looking at other options around it, whether it's physician assistants, associate physicians, etc. So ongoing conversations. Nurse practitioner, we have 2 that are supporting the area. one working in primary care and one working in primary care, but also supporting the emergency department as well. You'll see the stats from April 1st till March 3rd, 2024 to March 31st, 2025. 129 inpatient admissions for the facility, 3,610 emergency room visits, 2,844 diagnostic imaging exams. So you'll see the breakdown of x-rays versus electrocardiograms. So ECGs, 1,800 versus 1,000. And then staffing overview as far as RNs and LPNs go. Currently, we have a 2 RN, 1 LPN model on day shift. You'll see it has 2 LPNs up there. Currently, we're just working with a few of our LPNs that are working days only, which then we coordinate, and our nights might have 2 RNs only. But our goal with staffing is 2 RNs and 1 LPN around the clock, which then supports both the emergency room and the inpatient care. We currently have successfully recruited international educated nurse to the facility. We have full-time LPN grad coming in June, full-time and part-time vacancies at the site. We have 2 full-time RN permanent vacancies and 2 temporary RN vacancies at the site currently that we're recruiting to. And we're currently have some travel nurse staff at the site. You'll see rehab. We have 1 physiotherapist vacancy that's ongoing recruitment. Occupation is the job is full and providing that service. Diagnostic imaging and labs. So we have a diagnostic position posted for a second full-time tech. And our lab, we have a new medical lab assistant that was hired just in December, which has been a huge benefit to the site. And social worker, we have a new social worker that started back in the fall that is on site 2 days a week, and he provides service to Buchanan, Victoria County, and Sacred Heart as well. Successes, 25-year celebration just happened this last summer. New X-ray equipment, which was opened in August of 2024, which was exciting. Chrissy Halley, our new site lead, started in December 2024, and Chrissy's from the community and a very engaged community member, so it was fantastic to have Chrissy. Our prescriber pilot program that's supporting ED as well as primary care. Foundation has been very beneficial and very great partnership, and we just purchased a Lucas chest compression unit, which is a unit that will help with chest compressions as needed, and ongoing recruitment of staff and physicians, and we're continuing to enhance the access up there through our primary care with alternatives like RN prescriber and nurse practitioners.
Good morning, everyone. For people that didn't hear, my name is Glenn Cox. I'm the Executive Director for Community and Rural Health, and I'll be giving the update for Victoria County Memorial Hospital. Before I get going, just want to give a shout out, obviously, to the staff of both Victoria County and Neils Harbor. Very, very dedicated professionals, very supportive of the community, and I think everyone in the room would agree that they're very hardworking staff and support the community in relation to healthcare. For the overview of Victoria County Hospital, as people know, it's a 12-bed hospital, 90+ staff. For primary care, we have 4.5 positions. Right now, we have a 1.0 and a 0.5 vacancy, but we will go up to 2.0 if there was a physician that was interested in making that 0.5 a full-time position. Currently 5 family physicians in the community, 2 share 1 full-time position. We have a nurse practitioner, or an NP, but was just added, and the access to primary care, I believe, is second to none within the province, within the community in the catchment area for Victoria County Memorial Hospital. Stats as of last fiscal, which ran from April 1st to May 31st, 2025. Inpatient admissions was 207. Urgent Treatment Center, or UTC, visits was 7,511. Diagnostic imaging exams was 5,602, which was broken down into x-rays at 4,422 and ECGs at 1,180. Just to show the utilization, the x-rays was actually a 15% increase over last fiscal. So the service is definitely being used, and our admissions, we were up 10% in relation to our admissions from last fiscal. So the hospital again is And I believe today we're at 100% occupancy at Victoria County. Staffing overview for nursing, we have 3 permanent full-time RN and 2 temporary full-time RN vacancies. No LPN vacancies, which is extremely good news. And currently we're utilizing 2 travel RNs to support our staff. Diagnostic imaging with lab and rehab services. DI, we have 1 full-time MRT. Oh, sorry, I should be changing the slides. My apologies. We have 1 MRT, which is full-time. We did one of the other full-time MRTs or medical radiation technologist did leave for a job with still within Nova Scotia Health, but we do have a student who is willing to come back to the area and have a return of service out to that individual for the, I believe, within the next year. Lab services, we're staffed within our lab services. Very fortunate. Friday I was on site doing a site visit with Megan, and we just welcomed a new medical laboratory technologist who assumed a full-time position effective Friday, May 2nd. So that was great news. Rehab services, staffing is good with rehab services as well. As Andrew mentioned, allied health, social worker, we have a shared position between Buchanan Memorial and Victoria County Memorial Hospital. Registered dietitians Monday and Friday, seeing both inpatients and outpatients. And we have a continuing care coordinator position posted. Successes within Victoria County Memorial Hospital. Successes is be marking its 30th anniversary this year, and I will give a shout out. I just saw Diane Grant, who I used to work with a long time ago when she was the facilities lead here, or the site lead at Victoria County. It was great to see Diane. Megan Morrison started. Oh, talking too fast? Oh, my apologies. Sorry. Okay. We do have Megan Morrison here, who has started as our new site lead, which began in July 2024. Physician-led collaboration between Alderwood and Victoria County Memorial Hospital allows some residents from Alderwood to be admitted directly to Victoria County Memorial Hospital, avoiding an emergency department visit to the Cape Breton Regional Hospital or Inverness, and keeping the residents in Baddeck. Local physicians have hosted 6 Dalhousie medical residents since November 2024, which again encourages possible recruitment and retention to Victoria County Memorial Hospital. In relation to lab services, we do have new lab analyzers on site, with some testing can now be done at Victoria County Memorial Hospital, which increases turnaround time rather than those tests being done in Sydney. Our next steps, ongoing recruitment of staff and physicians with ED qualifications. Our goal remains access to 24/7 emergency care or emergency services for this community. We're engaging community working group on health services planning for Victoria County Memorial Hospital, identifying priority areas and explore off-site space program options. And we're exploring other care options, including virtual care, mobile primary care clinics, and more EHS after-hours partnerships. With that, I'll turn it back over to Andrew Heighton to discuss our urgent treatment center and emergency department updates.
Hello. So yeah, as we know, our UTC is open daily, 8 a.m. to 4 p.m. And since late 2022, and we've had even minimal closures for our UTC over that time, which was, fantastic in itself. UTC has capacity for approximately 20 to 30 visits per day. Average number of visits for March 2025 was 21. Northside UTC had 8,500 visits from April 2024 till March this year, and the Northside average of visits for March 2025 was 32 visits. Victoria County UTC stats for April 2024-2025 were 7,511 visits. Approximately 63% of those visits do come from the Cape Breton Regional Municipality. 25% of those visits are from Victoria County, 12% of those visits from Inverness, Richmond counties, and mainland Nova Scotia and other provinces, as you would expect, with it being a tourist area in Cape Breton. Some of the reasons people do come to the UTC, Victoria County, would respiratory, ear, eye, nose, throat, musculoskeletal injuries, so pains, strains, skin integrity, rashes, and some GI or urinary tract type visits. And you can see the percentages go down for those visits. So our main one is respiratory. And as Glenn mentioned, the goal in access is 24/7 emergency care. We do not have a timeline as far as reopening the emergency department. Existing physician group we have in our community, are interested in providing primary care, no longer interested in the comprehensive model that did do primary care, inpatients, and emergency room. We're continuing to work to stabilize and enhance access to care in Cape Breton regional municipality. Access to primary care and urgent care has improved. Patients continue to seek care outside of Cape Breton regional municipality for things like urgent treatment, etc. Northside UTC is open 6 days a week. Glace Bay ED open 3 days a week, but it's in the process of adding virtual urgent care, virtual emergency care, and looking at providing more access on the days that they aren't open. And then continuing to partnership with EHS, with Victoria County on opportunities we can do after hours. And like Glenn mentioned, currently, supporting transferring to our UTC or after hours if it means being able to keep a resident in the community and an ambulance in the community. So what's needed next to open the ED? We need physicians that are interested and willing and able to work in emergency medicine, nurses with emergency medicine training, which we continue to try and keep up training and skills for our nurses at the site. And as new nurses come in, look at opportunities to train them, stabilize and enhance access to care in Cape Breton regional municipality. How are we working towards the goal? Physician recruitment. Efforts are focusing on physicians who can provide emergency department coverage, full-time, locum, part-time. There are postings up looking for physicians that are interested in the comprehensive model, like I mentioned, or locum physicians that can come in and provide emergency medicine only. Locum coordinator has postings up and is working with RJ McKenzie, emergency medicine lead, Glenn Cox, and myself around postings for locum physicians, site visits, webinars. The team was just out at a rural remote recruiting in Winnipeg for specifically rural medicine physicians, and CBU Med Campus that's opening soon, and I do believe they have a cohort already accepted seats to go to that med school, so that's exciting. That it's another step closer to being open. And physicians establishing practices outside Central Zone, eligible for the $125,000 over a 5-year bonus to come to rural and remote areas to provide service. And then nursing, like I mentioned, continuing to train and keep our competence up for our nurses as we hire new grads or other nurses that have come from other areas. It's continuing to offer those training both in person and virtually through our professional practice team. And then incentive programs for rural nurses. Great news. Meg and I talked, we have 2 nurses on the weekend that are interested in coming to Baddeck, so that's just fresh off from the weekend. So it is working as far as recruitment, but keeping that training up. And Cape Breton regional municipality physicians and staffing vacancies at the Cape Breton Region Memorial Hospital and Glace Bay emerge, and just continuing to increase access in those areas to support those communities, which will in turn continue to support communities outside of the municipality. EHS partnership programs, like we mentioned, continuing to grow those. We had a great meeting last week with EHS and on site with Megan and staff, and looking at opportunities for low acuity patients to come to the Victoria County Memorial Hospital either during the UTC and looking at after hours, as well as partnership with Alderwood and supporting those patients to come to Victoria County Memorial Hospital when able, to avoid having to go outside of the community. Even with the ED closed, we are a busy spot. Ambulatory care department, as you'll see on the previous slide as well. But the ambulatory care in itself has 1,400 visits on top of the UTC visits. And we also have visiting clinics, NP clinic, diabetic clinic, palliative care, chiropractor, eye clinic, Dr. John Hamilton, geriatric, oncology, and cardiac clinic. And Megan is continuing to work with those services and increasing those services on site or in the community as we see demand increasing. converting space, like I mentioned, converting space to provide those services, converting space on site for mental health and addictions, now provide 5 days a week. We went up from 2 days a week, which is a huge increase in priority. Upcoming construction projects, we're looking at internally having 2 more primary care spaces and then another 1 or 2 more clinic spaces so we can support more access to these clinics in your community. Our question is, how can we work together to build on these to shape the future of Victoria County Memorial Hospital? So one is the working group formed in October 2022. It was formed at the time with the closure of the emergency department and looking, what can we do for the emergency department? How do we get back open? Transitioning from the UTC back. That was the main focus. And as we move forward and through the years and months, some of those, that's still a priority. And we're starting to look at other health service planning opportunities. Like I mentioned, getting other clinics, other services into the area. So bringing the services to communities. But the emergency department is still one of the agenda items and the main focus. Members include, you'll see up there, local physicians, Nova Scotia health staff, physician recruiters from both community and Nova Scotia Health, municipal governments, community health board, Alderwood, Wagmacook, Wakaba, First Nations communities, and other community members at large. And if others are interested in joining, my contact is there. I'm here today. We can talk about it. Looking for opportunity around health service planning as a whole for the area. And some helpful links. Looking at UTC overview, virtual care Nova Scotia, Your Health NS app, and pharmacy primary care clinics that would be available to anyone in the province. And these are great. Your Health NS app is a great app to have on your phone. It does provide a lot of information.
And I'm going to use the last minute and 32 seconds here. Thanks, Andrew and Glenn. I know there were some additional questions from councillors around update on the project from the Cape Breton redevelopment. So I'll comment on some of that. So the Cancer Center is coming along quite nicely. We're looking at late 26 for that to start to become functional. There's also the clinical services building. So I'm not sure if anyone's driven past, but the large concrete structure that's 8 stories tall with the 2 cranes, that works in relation to the concrete work is nearing completion. So those cranes will be coming down. But the services that will be included in there will be a new emergency department with additional bed capacity. 30 critical care inpatient beds. So 10 will be ICU, 10 will be coronary care, so cardiac care. And the other 10 will be, we'll say, in intermediate care. So it's almost a step down unit with the ability to have those flex across for patient demand. So if there's one area of need that's flexing and more demand, then we'll be able to increase the capacity there. There's also new surgical OR suites with some specialty suites in relation to cardiac cath lab for Cape Breton Eastern Zone. So folks won't have to travel to Halifax for cardiac catheterization, which would be a big deal. We also have 2 full 36-bed inpatient units. They'll all be, more acute care, which will allow us to repurpose the existing beds within the Cape Breton Regional Hospital for alternative levels of care, convalescence care, restorative care, so that we can help support people get back home after their acute episode of care is over. There'll also be a new family, newborn, so mum, baby, women's, children's health services within that facility, as well as a new medical reprocessing department as well. There will be 1 floor of infrastructure to support the entire tower itself, but quite a few new services going in there that are needed based on patient demand for Cape Breton Island and Eastern Zone. The Northside Healthcare Complex, that building's now weather tight. Construction and focus will be internal now. There's dialysis, urgent treatment, diagnostic imaging, lab, all the services that basically were in the Northside facility, including endoscopic 60 inpatient long-term care beds and 12 short stay beds for that local area, as well as a large laundry facility that will be able to service the most of the island, if not eastern zone itself. New Waterford, the turf has all been reclaimed and removed and made new. The new school is up, and we're taking down the old school in preparation for a similar build in relation to North Sydney, but just smaller in nature, but a lot of the similar services. In Glace Bay, we already announced the renal dialysis opening back in 2020. The detail design is completed around the construction components of that facility, around the refresh and renewal of Glace Bay, and some more work to be done there. I know I'm over time, so I'll pause there, and I'm sure some of the stuff might come up in question.
Thank you. I'll take any questions from council. Does anyone have any questions? Councillor Patterson?
Thank you, Warden. Just the last thing you mentioned, Brett, the new Northside General. I didn't hear you mention an ER. There's no ER there?
No, there's no planned ER in that facility.
Okay, thank you. I have no personal complaints about the medical system. I mean, this old body has been going fairly well for the last 70 some years and maintained by good doctors and good nurses and so on, pharmacists. But I do have a question or a comment, I guess, and it hasn't changed really a lot in the years. People coming from Ross Ferry especially used to have to make a decision if they had an emergency to either go right to Sydney or left to Baddeck. Now they're going right to Sydney or left to Inverness. I had a family member who had to go to Inverness. She received excellent care. She got right in, no problem. But the drive, of course, is the issue. So, I mean, that's just the reality of people on the ground. They make that choice either to go to the regional or to go to Inverness. And I think a lot more people are making that choice to go to Inverness because even with the driving time, you're saving time, not having to wait so long. I'll leave it at that. Thank you.
Councillor Bourne?
Can I just a quick comment on that? Thank you for the comments. I would. I understand that Inverness does have emergency department capacity. Team is fabulous there. They are limited in the amount of emergency situations they can manage. The Cape Breton Regional Hospital is a level 2 emergency department trauma center. It has the capability to deal with almost any emergency, and so I would recommend if it's a true emergency that they should turn right to the Cape Breton Regional. And if those patients are, in an emergency situation, they are triaged appropriately, and the higher level of triage ensures that they get in timely. Yeah.
Councillor Bourne?
Thank you, Warden, and thank you for coming today to do the presentation. Some of the feedback that I'm getting in my district is really when we created this motion to send to Nova Scotia Health to respond back, was a clear path forward on when the emergency department is going to be reopened here in Baddeck. And I don't think we're seeing that in the presentation. Secondly, what I seen in the presentation was what was needed to open the emergency department. On your list 1, 2, and 3, number 3 was to stabilize and enhance access care to CBRM. And I believe that probably would be number 1. That is the reason why we're probably not open in Baddeck. It's because of the stress in the CBRM area. I also wanted to note with the high amount of people coming from CBRM to our UTC, and I just wanted to clarify, like, we have amazing staff at the hospital. We are all here to, and I think in agreement with the amount and level of care that's being provided is exceptional. But with that being said, we do know that around 80% of people are coming from outside of Victoria County to come use the UTC. But we want it to be clear to say 100% of the people are leaving Victoria County or this catchment area for emergency room, for an emergency department, and we need to do better.
I'll comment on the access around the CBRM. So I think if people can recall where we were a few years ago, the comments were made and they were justified that care needed to improve in relation to primary care, urgent care. And at that time, the Glace Bay ED was not open. The North Sydney urgent treatment was just opening. And we had some challenges in relation to primary care attachment. Some of the physicians here locally were stating that that was certainly a significant factor in relation to wanting to take a break from emergency care and suggesting the UTC was the level of care that they could provide. And we tried to work with them in relation to setting that up to try and support them in staying in the community. Since that time, we have Glace Bay open for 4 days a week, not nights, but days. 3 days where we have someone in person. The 4th day we have a virtual emergency on call, able to see 20 odd patients. North Sydney, as you saw on the notes, is open 6 days a week. Many days they're able to see double capacity, which is 50 patients a day. We have pharmacies able to see patients, which was not the position we were in at that point in time for a number of, I'll say, less urgent care demands. And the attachment in the CBRM is leading the province. We're down to 7.7% patients requiring attachment to a primary care provider. Now it's a little higher in the Cape Breton municipality. It's anywhere between 10.7 and 11%. And we're actively recruiting in relation to primary care, which is the foundation of our health system. So I'll say that the access has improved in CBRM quite dramatically. I think where we're running into some challenges and not unique to Cape Breton or this area is patients, for a number of reasons, no longer want to wait to try and gain access. They go where they feel that they can gain more immediate access. Not everything is an emergency, but things that are urgent or when people are worrying about their health condition, they get to make a choice, and sometimes they choose to leave their location, and that's going to be difficult to try and control that. I think our goal is to continue to try and bolster the services within CBRM so that people have good foundational primary care, and then continue to expand on Glace Bay, Sydney, Baddeck. But saying that we're going to be able to sort of pause or stop people from coming here, that's going to be always a challenging thing to do.
Councillor Matheson-LeFort.
Thank you, Warden, and thank you for coming today. You might not have an answer to this because I was just looking at the UTC stats. When I moved back to Canada, I noticed that the role of pharmacists had expanded. Do you have any stats on how the role of expanded pharmacy services, has it reduced any of the UTC? Like if you're looking at like UTIs or respiratory, are there any stats in this area?
We don't have them. They're not. Those pharmacies are not attached to Nova Scotia Health. That might be something that we could ask the Department of Health for. It may be something that they already ask in relation to funding they may have received, but I know from personal experience, instead of going to a UTC, I've used the pharmacy myself in relation to my daughter and my own care. So I think it is a good access point for those things that they're able to do. I do think people take advantage of it. I don't know if we have the numbers to say how much.
Okay, thank you for that. Councillor McLeod.
I mean, like could be the open as a shop, right? The problem is we don't have ER opens, doctors. Oh, sorry. And my second question, thank you for training the nurses. That was one of the concerns about to train them in emergency. So just keep the curriculum. And thanks for the answers about the CBRM, because I think the community have to know the CBRM is not good, it's not healthy. we are not healthy. So it's just a snowball. And when you have a timeline for that opening in CBRM, we're waiting more than 4 years now. What is the timeline for that as well? And the last, you're going to have a community engagement in May 7. So if you would like to just address what you're expecting or why they will expect the community to do in that day. Thank you. I know it's a lot,
That's
but
5
thank
questions,
you.
So yeah, I think the first question around emergency department physicians. So we are looking currently at Australia, individuals from Ukraine. There's been a recent trip where we've gone down and looked at expat Canadians who couldn't get into medical school in Canada but went to Australia. We have some good intel in relation to physicians who are interested in coming back to Canada and Nova Scotia. I think the challenge is, how do we get them to come to Baddeck, or how do we get them to come to any of the other rural facilities, and or in Sydney, CBRM as well. So, since the physicians in Baddeck made a decision that they didn't feel that providing emergency care was something that they were interested in, it puts us in a bit of a different starting position. It's very challenging to start from scratch to build up an ED from scratch, but if we can just recruit one, or if we can get a locum, or we'll need a starting point. But as soon as we can get interest, and I think the community has a role to play there around supporting recruitment. So certainly open to partnership as it relates to that. But we have the capability to keep the staff trained in relation to simulation and learning, to keep the nursing staff, the diagnostic techs, lab techs. We haven't withdrawn any services or any other personnel. Our goal and our hope is to try to reestablish an emergency access here in Baddeck. And I think by not removing those services or personnel and trying to continue to build into the site, I think that shows our commitment. We're just struggling with and this is right across the province and the country, struggling with retaining emergency department trained physicians who are interested in coming here. So that's where we're trying to put our focus.
Okay. And
sorry, the question on the new clinical tower. So right now that's timeline between the end of 2028, 2029. Okay. Some of that is construction time, material. We've already had a delay through COVID for a period of time, but we continue to have regular check-ins with the team to try and keep moving that along. The same with the cancer center in North Sydney as well.
Yeah, and just to give them, to the public a little update about when we drove there, we see it, but if it's going to go, it's going or not going. So, and my last one will be, as we have to go to the ER in CBRM, and I understand personal and with a family, it's overcrowding, right? And it's not only in Baddeck, it's CBRM residents as well. They're concerned about that. It's in bad shape. Really, we are in closets, we're in the halls, and I understand the staff is doing whatever they can, but is anything they're working it out to relieve that? Because for us, when we need to go to CBRM, we think it twice, right? Because sometimes why I'm going to be in a closet for 8 hours, right? Until I have a bed. And it's not, it's just logistics and everything. But do you have they are doing something for that, about that?
We are trying.
Yeah.
So the bed capacity at CBRM facility, the Cape Breton Regional, is at about 113%. Okay. And so that would speak to why you end up seeing a bottleneck in the emergency department around access and flow. Some of our solutions are dependent on partnership. So, I believe the other day we had 24 long-term care patients in that facility. So access to long-term care to free up acute cares is certainly important. We try to move patients across the other 3 facilities, North Sydney, New Waterford, and Glace Bay. And we've also had to ask, the physicians in Baddeck and Inverness and other locations to see if they can help out in moving and positioning patients so that it would keep freeing up the ability to have capacity at the regional site for emergencies. We also have added in rapid assessment zone in the back. So we have physician assistants, we have nurse practitioners. and a team that's in behind trying to alleviate the lower acuity, so the less urgent. So it's not that they're not as important, but they're not a true critical emergency, but they still need to be addressed. So we're trying to bring them around the side and have a different pathway for lower level access. And we've hired some nurse practitioners, we've hired some physician assistants. We just need the nursing team in the space. And so we're working on freeing up the space. We're currently looking at moving the neurology team to a new location to free up that space, which is in close proximity to the emergency department. So there's a few internal moves that we have to do. We're seeing some good results from it already, so we're hoping that that will help with some of the ebb and flow. But the bed capacity is certainly something that we're trying to work within the teams as it exists today, and that's why we need the redeveloped space. That's why we need those extra 72 beds. But that's an ongoing piece of work, and I think that's reflective right across the province. Other regional sites are dealing with the same thing. It's around the volume of patients coming in and the complexity of care, and we're trying to manage through that. And I think the team does a great job. It's just challenging with the numbers.
Thanks so much.
Thank you.
Councillor Hennick.
Hi there. Thank you very much for coming and doing a presentation today. I live in District 8. I'm the furthest up from northern part of our beautiful spot in Victoria County. We have a lot of shortage of staff at Buchanan Memorial. With that issues, we had our lovely Dr. Ken Murray came back for a few weeks to do some clinical there. He's one of our great doctors in the area that doesn't seem to want to retire, and we're so grateful for him for doing that. But long story short, we are, what was it? We only have 2 doctors at the hospital. They're only working part-time. I know they have received some doctors that come in and do a little rotation in that, but something stability would be great. We're so far up the northern side that even a drive to Baddeck or drive to Sydney in emergency is far when there's no doctor on call or if they can't get anybody. Same with our ambulance system. It seems to be a never-ending story for us. We seem like we're almost forgotten because we're so far down on the totem pole, as you say, when it comes to nursing or doctors. I know housing is a big issue. Where would they stay? Where would they live? But we would like to see, like what CVU doing their programs, that we have doctors that's going to come and stay. Decide, this is a beautiful area and let's stay here. But with that being said, we just had a health fair pop up in our district in Bay St. Lawrence, and that was very well received because it was some things that we needed to be looked at, hearing, dental, other stuff that really worked out good. So we would like to see more of them pop up in their communities. I think it would be a worthwhile thing to look into. I know Baddeck has one, I think, coming up May 7th with their little thing, but we have to do something to get more down. I know everybody's hurting for physicians, but we really need to really open this up. But thank you very much.
So Kerr.
Thank you, folks, for showing up today. I know it's uncomfortable being in the hot seat there, but anyway, the ER in Sydney, anybody that's had to use it, I'll tell you, it's a nightmare. I have a couple of questions. One, is it lack of doctors that's causing the problem there? And also, have they looked at other ER models in rural Canada or US or whatever that may apply to us here that could help us out?
So the answer to your first question is yes, we have a shortage in Sydney as well. So we have 5 vacancies at the Cape Breton Regional Emergency Department. We would probably need another 2 to get Glace Bay fully functional, 7 days a week, 7 for 12-hour shifts. So that would be the answer to the first question. I think you heard me comment on bringing in physician assistants, nurse practitioners, again, trying to streamline some of the patients that are triaged, and then they wouldn't have to wait in the waiting room. They could go around to another waiting room we have in the back for, again, that lower acuity. And so then, therefore, the team in the emergency department could focus on more of the higher levels of care that are required. We have patient attendants out in the emergency department because we know how challenging it is for patients to be out there. We also have providers that go out into the emergency department as well to do secondary triage, checking in on patients. And then space, I think you're from the other counselor, space is a big challenge in relation to bed capacity. So we're continually working on that. We meet multiple times every week. We have check-ins every morning, every afternoon, trying to create an ebb and flow in the facility and work with other facilities to transfer patients across, Cape Breton Island, Eastern Zone, so that we're trying to free up as much bed capacity, which then is reflective on the ED access at the Cape Breton Regional Hospital. I think the other thing that may be helpful this summer is, we have some good news around the Strait Richmond area, which has been challenged with ED coverage, and we have some physician locums that are coming end of May, June, July, and August. So that should provide some additional access points for that side of, I'll say, the western side of Eastern Zone, and hopefully that'll alleviate a little bit of pressure, but not all. And there's just a lot of work to do. It's there's a lot of logistics. There's a lot of resources that are required, and space is certainly one of them. And we're hoping that a neurology space that we're freeing up, there's almost 12 rooms there, that we can really kind of move some things around to allow patients to be seen a bit more quickly versus what's occurring now.
Experience to go there.
Yeah, I walk through there regularly. I see what you're seeing when you come in as a patient. I do.
I've seen the clinics you have. I don't see any mental health counseling that comes to Buchanan Memorial. Is there one that comes to Buchanan Memorial?
Yep. And I'm not sure which slide that was on, but I did speak to that it was 2 days a week, and now it's 5 days a week.
Is that virtually or in person?
Oh, Buchanan, sorry.
Buchanan, yeah.
There is a virtual crisis support for Buchanan. It's actually available through the merge. So if someone was to come in, or if primary care, we do have virtual access. I'll say seven days a week, and it'd be through the Cape Breton Regional Hospital, and we can arrange that if it's the appropriate avenue for the patient at the time. So there is that access, and we're continuing to work with mental health around possibility of having some clinics in Buchanan as well, just like Megan has been arranging for Victoria County.
Yeah, mental health is a major crisis in our time this area and stuff. Also, are they going to be offering another CCA program for the communities? Would that help?
I don't know the answer about the CCA program. It's not something that Nova Scotia
just
Health
didn't know if
offers.
you might have heard. Do you have a question there, CAO?
So I just have one question. I know you talked about CBU with the medical school opening there. Is there a timeline on when those doctors or residents would be able to get out, and what's your time frame on them helping to relieve some of the capacity issues or the vacancies, and what is their return for service?
Well, I'm not on the medical side there, but I can try and answer a few of the questions. So my understanding is the first group of students starts this September 2025. It's a 4-year program. So some of those residents will be out and working within facilities right across Nova Scotia. It's not specific to Cape Breton. There's work happening at the Cape Breton Regional Hospital as well to try and create learner spaces and learner opportunities for them to support the CBU Med Campus. Once they finish their 4 years, then they have to go into a residency program. I believe it's 2 years, where they would go and work in care settings, kind of like as we have a residency program now. It's more of an extension of that program, where their specific focus is rural. So that's the whole intention of the CBU Med Campus program, is that it's a rural program. So primary care, sort of jack of all trades, and then hopefully they'll be interested as well in having emergency supportive education. I'm not sure. There's quite a bit required to become emergency department certified. There's more years of education required to become a fully ED certified physician, but you can obtain enough certification and other education components to make yourself feel competent and confident enough to provide care in rural settings. So you're probably looking at about of a 5 to 6 year window before those folks are out and practicing on their own. That being said, the return of service, I believe, is 5 years. And I think the majority of these folks are from Nova Scotia, so the likelihood, hopefully, is that they'll remain even after the 5 years. Yeah.
Okay, we're gonna take some questions from the audience. If you have, come forward, please. Yep, they're gonna sit right there. Yep. Councillor Patterson, you look after them. Tell them the mic's on.
With the technical assistant.
Oh, well, what's that? No.
I think so. Hey,
Speak with it to the mic, man. There you go.
the holdup at the regional hospital.
Excuse me, first, can you state your name, please?
Dr. Mary Hutchison, retired, worked in North Sydney for 40 years. The holdup at the regional hospital is one of the primary reasons why we can't have an emergency room now. Can you see maybe adding an extra urgent treatment center in Sydney until your increases in emergency room happen? Because I'll be dead before the 6-year residents come.
Right.
The other thing is the irritating thing that I've heard from friends and others. The fact that our urgent treatment center gives excellent care, but it closes at 4 o'clock. If I have a minor laceration, a minor urinary tract infection, a minor fracture, I don't see right now why one of the 2 nurses doing inpatients couldn't go do a little first aid and book them into the urgent care for the next day. That would really eliminate a lot of irritation of driving 80 kilometers on a twisty road, especially if you have a screaming kid or whatever. And I think it is just insulting.
So you're.
So thank you, Dr. Hutchins. I think your first question around the UTC in Sydney, I think that's what we're looking to replicate as it relates to the rapid assessment zone with the physician assistants and the nurse practitioners. I think, as you'd be aware, we're not only challenged with emergency trained physicians for emergency departments, we're also challenged with trying to have physicians pick up additional UTC shifts. Even in North Sydney, we don't have double shifts all the time, but we're certainly open to anybody that's willing to do that. So that's really that rapid assessment zone that we're trying to replicate, so that there's close proximity to physicians for physicians assistants to work with and collaborate with, because I think you would know that they have to have a collaborative physician agreement and check in with those folks for each patient they see versus a nurse practitioner that can practice independently. So we have a combination of both there. So we're really trying to replicate that secondary access zone. Also trying to get Glace Bay, up and more functional, more days a week. I think that would be important. I think that speaks to your more access. And again, we're trying to promote North Sydney for 7 days a week and double shifts. And so hoping that we can, and I agree with you on that. The second statement around after the 4 o'clock, I know Andrew and others, we've been trying to explore virtual urgent care, virtual emergency care. So we've had some success with that in Glace Bay on a few days when we don't have physicians available. So that may be something that we could look at for the evening hours of Baddeck while we're trying to, to stand the ED back up. But some of the resources that are currently provided to do that are daytime again, but that's something we are exploring. Yeah.
The other thing is that I spoke to someone who worked in here for 30 years. And she said that if we don't have an ambulance station here, we will never have an emergency department. Because you need someone to give the TNK to save your heart or my heart right away at the hospital, and you don't have that right now.
Mm.
So maybe you can speak to your EHS friend.
We do meet with them regularly, but certainly yes, EHS, acute care trained EHS teams would have that capacity to give that medication. I don't think all of them are trained though to that degree,
No,
but
they're level.
different. Yeah, I know you know that. Yep. Thank you.
Thank you.
Do we have any more questions?
Did you want to comment?
Come forward, please, and state your name.
Yes, I'm Shirley Fraser. I wondered about Sacred Heart Hospital in Chebucto. Do they still have an emergency department there? And I think they had 5 physicians. Do they still?
Fully operational.
It is fully operational.
Yeah, they
So-
still have a 24/7 level 4 emergency department.
Yeah. So why do we refer to Inverness and not to Chebucto? It's closer. It's 24-hour care.
Yeah, so we don't refer anybody. I think that's patients making
Well,
that decision.
I'm
to-
just saying, do members of Victoria County know that?
Oh, yeah, I don't know.
They do. And it's very accessible.
Yes, yeah, they have a great team in Chebucto. Yeah, a lot of just the same as Baddeck and Inverness. A lot
Yes.
of caring individuals. Yeah.
Okay.
Hi, I'm Patricia McDonald. I'm a retired nurse. And maybe you can't answer this, but you referred to Straight Richmond having locums all summer. Is that 24/7 care?
Andrew has more information on that, but yeah, he
Yes.
can. Yeah.
Let's speak to it.
We so Great Richmond, we currently have just for the audience, one physician at the facility, Dr. Hansball, who works Monday, Tuesday, and Thursdays. So starting actually next week in May, we have a locum coming, Dr. Shazad, who has come over the years to Straight Richmond, and he has reached out looking to come for a longer period of time. And we have another doctor, Dr. Lucier, who provides the odd locum. So for May till, and in July into August, it won't be 24/7 every week, but it'll be close. There'll be a couple of daytime shifts in there, but
Yeah.
it'll be close to 24/7 opening. Yep.
And I heard this, I don't know if it's fact, but I understand they have a full-time recruiter in Straight Richmond and one in Inverness, just for medicine, nursing, allied services, clinical services.
Yeah, I can. So in Straight Richmond, so there's a Cape Breton South recruiting, which is a municipal initiative. So they to the municipalities of Straight Richmond, Port Hawkesbury, they hired a healthcare recruiter, Gina McDonald. Inverness County, the municipality, recently has hired a health recruiter, Lynn Carter.
Yes.
And those are both through the municipality in those areas.
Okay, that was my next question.
And we work close with them, but they're not hired through
They're
Nova
not
Scotia Health. No.
employees of the health
But
authority.
I will, they've been, yeah, and we have our own. We have our own recruiters that will be collaborating with those county
Those,
council
yeah.
recruiters.
Yeah, so
Correct.
is there an option to have a similar position for Victoria County? You can, and
You would have to ask the
Yeah.
council that.
so they're employed by the municipality.
Correct.
Okay, thank you.
We have time for one more question. Seeing no hands up?
Can I just make a comment?
Sure.
About the recruiter, we have a recruitment committee a couple of years ago. That way we have all the doctors. So if the community is, he would like to form again a committee for recruit emergency doctors, we can talk because couple of years ago, we put away some money in budget for that kind of services and help. So if any of the public would like to do it, but just contact us. So to work with.
Just to Councillor McLeod asked me a question. I never got back to you. It was about the community engagement on the 7th. So similar to the year before and the year past, we planned 4 community visits this year. So Baddeck, Ingonish, Neils Harbor area, Shetty Camp, and Inverness, and we're going to Inverness Council as well. So they're all planned, and our goal is again to share information, to get feedback from community, to share what's happening at the facilities and healthcare services outside of the facility, and look for opportunities to partner. Yeah.
This is the last question.
Is this on? No, the green light is on. Thank you. My name is Betty McCauley, and I'm from the Baddeck area. I was an LPN at the hospital here for 40 years. How confident are you in the fact that we will get an ER here? Because there's a lot of negativity from a lot of people here that it will never happen. I heard what you said about the recruitment of doctors, but what is your thought on that, other than what you said? Thank you.
That's a tough question. Probably the toughest one here. The my opinion is that we're committed to ensuring that we have the right resources to support physicians when we can recruit them to here. We could have easily said, you know what, we only have a UTC, and therefore we're going to pull back on diagnostic imaging and lab services and pare down the team, and we haven't done that. We continue to invest in the team at Baddeck. We continue to invest in the facility. We're interested in how we can, move some services outside of the facility to create more capacity in the facility. So I'm optimistic, although it is challenging. I'm not going to lie. There's a lot of other communities in Nova Scotia and across Canada that are competing for the same scarce resources. And I think the question around community recruitment involvement is an important one. I think we've had some experiences where that's made a difference. Does it always make a difference? I can't say that it always does, but it's certainly helped in some scenarios. I think the partnership across the working group with council, getting the message out about where we are with healthcare, I think that all makes a difference, and that we're promoting things together. And I understand, from a community that there's a lot of concern because there is no emergency department services. I would highlight there is a lot of service though at the facility. The team does a great job in providing a myriad of other care options. And I don't want to downplay the concern from the community. We hear it, we feel it, and our ultimate goal is to try and get the services stood back up. So I would say I'm optimistic, but I think it's going to take effort right across the board.
Just further to Brett's point, like our commitment is to to try to restore these services in this community. We know it's an important service to the community, and it's also an important service in relation to Eastern Zone, because with Baddeck closed, it puts pressure on our Inverness facility, and we're seeing that, and it puts pressure on the Cape Breton regional facility. So, but I know from the commitment of the table here, I know Megan, Andrew, Brett, myself, and others. I know Don couldn't be here today. I've been in this position now for a little over 3 years. Straight Richmond was a struggle, and right now we're making some progress. We're making headway. So the commitment is to continue down that road. I saw a physician here. A physician was here on Friday. I got to meet her. She was an American physician. I know she met with Dr. Hewen. She met with Dr. De Clemente, and they connected because they were American. There's so many offers to them out there. I don't know what will become of that, but we're committed to it. We're looking at our DI room here at Victoria County. We're looking at renovations in that area. We have new equipment up at Buchanan Memorial Hospital. We're committing those resources for lab, DI, Again, to Brett's point, right now, it's a bit of a human resource issue trying to get those physicians, but we know the community, we are trying. I guess that's the point I'm trying to get across, and it's a process, but I know that doesn't alleviate the worry, the fear, but I think we will try to work on this every day. We're here with physician recruiting, and we're looking at locums now to come into Baddeck. And if it's, someone asked me, is it a day? Is it a 24-hour shift? Right now, if we can get anybody to come in, it's a starting point for us to support them and get the ED back open. Thank you.
Well, thank you for coming. As you can see by the crowd behind you and the questions around the table, this is an important issue to all Victoria County. So take our comments and our questions back, and we know you'll work on them, but try to work a little harder. Anyways, thank you for coming. Oh,
I want to make one little point, and I hope I'm not speaking out too much here, but we did do a survey, and we don't have it ready yet, compiled all the information. But the survey we did for when we did the budget, the number one concern through all of Victoria County, the number one was access to healthcare services. And that's not something that, of course, we can solely work on, we can advocate for, but just to let you know, community, it's their number one concern is the emergency department and access to healthcare services. So please take that back, and again, a path forward would be great. Thank you.
I'm just going to say thank you for having us. I appreciate the opportunity to come and our team to come, and we will be continue to work diligently on this. Appreciate it.
thanks for the update. Next, we'll have Victoria Highlands Civic Center update. Excuse me. If you have questions, can you move outside, please? I'm gonna take that on here. Good afternoon. I will get you, I will get all the counselors to introduce themselves, and then you can introduce yourself to us, since we have new counselors on here. And we'll start here. We'll introduce Counselor Kerr when he comes back in.
Good afternoon and welcome. My name is Donna MATHESON-LEFORT, and I represent District 1. So I'm over Washabuck Peninsula and Buckla area.
Thank you.
Morning, Perla McLeod, District 2, Big Baddeck, Middle River, and Nyanza, and Yankee Line. Welcome again.
Good afternoon. My name is Fraser Patterson. I'm the councillor for District 5, which is the other side of the mountain, basically, New Hamilton, New Harris, and Bullinger.
Welcome. My name is Rosella Bourne. I think I know everybody here in District 4, so a little bit down Baddeck Bay, all the way to St. Anne's, Englishtown, and to the base of Smoky. Welcome.
Come on, Wanda Hennick, District 8. I'm representing Dingwall, Bay St. Lawrence, and Cape North, and Capstick, sorry.
Before I introduce myself, I have to send regrets from District 6 Councillor Tim Donovan. He's unable to be here with us today. I'm Jackie Organ. I'm District 7 Councillor and also the Warden. I'm from Ingonish down to South Harbour. Welcome. You have 20 minutes. The clock will be here, and then we have time for questions, okay?
Well, thank you very much for having us today. Probably won't take the 20 minutes, but wanted to provide you with an update of where we are with the steering committee. So we represent the steering committee here. We have John Trickett, myself, Jeannie Campbell, and Dave Parkinson here, and Terry Kelly is in the back here. So in terms of this project, which is the redevelopment of the current Victoria Civic Center, which is known as the Baddeck RINK, we are still in a standstill holding pattern with the, currently we obviously have the municipal support. We have since received the provincial commitment, and we are currently working on the federal funding portion. With the leadership race and then the federal election, it put a lot of projects in a holding pattern. We currently do have a federal application out that we are waiting to hear back on. The federal portion of the redevelopment project is approximately 55% of the project. So that is the big marker in terms of breaking ground and moving this project forward. The project still remains the vision for the inclusive, accessible, multi-purpose ice and recreation facility. In fitting today, in talking to Nova Scotia Health Authority, I mean, a lot of our rural challenges are interconnected, and they had talked about recruiting medical professionals. And we really do believe that this project is a project that enhances the community, it enhances our entire area. So it does include the official size ice surface, the indoor walking track, the community meeting room, community fitness space, the multi-use recreational spaces, equipment for cultural programming, commercial kitchen. So it does create that community hub for our county and those resources that are super important in terms of attracting new medical professionals and families to continue to live, grow, play here. In terms of next steps, we are working aggressively with our federal leaders and looking to get approval on that particular grant that we're going after right now. And we're in the process of liquidating the current building so that the space there will be ready so that we can start building as soon as we do receive approval. And in terms of ask, that we would just continue to ask that the public, the municipality, everyone continues to champion the project and make sure our representatives know how important it is so that we have these resources in our area so that it continues to be a place that thrives.
Any questions? Councillor Matheson-LeFort.
You, Warden. Have you thought of any other areas in Victoria County other than Baddeck?
We have. So this process, we've been at this process for 3 or 4 years, and
how we got to where we are took a lot of planning, took a lot of process. We met with community groups, we surveyed land, we looked at all the different options of what it would take to ensure this project was reasonable, affordable, accessible, and what that process came back with, that there wasn't appropriate land that was already serviced and that would suit this particular project.
Did you ever approach, sorry, I was just, the community of Wadmacook ever in on that plan as well? Has that ever been surveyed or?
Yes, they have. So they were part of the initial steering committee process, and they're no longer on the steering committee itself, but we are in communications with them and have talked about different options and opportunities. But there hasn't been actually any land that they had committed to the process or that they felt was suitable for it.
So
Thank you.
Part of our application was a support letter from Chief Norman Bernard and the county for the project as it stands right now.
Councillor Patterson?
Thank you, Warden. I spoke to John earlier, and we had talked about the situation as I saw it, or see it, I guess. I met as a member of the Federation of Canadian Municipalities with MP Batiste twice in the last 2 years, and one of the topics was the Baddeck RINK. The last time we spoke, he indicated that the application was in, as you said, and waiting to go to finance. And I don't know whatever happened after that. The election may have intervened because that was just in December. But just to, I hate to do this, but the federal government has not been stepping up to the plate with funding for infrastructure. And we have a case in point of the Ingonish wastewater system. The federal government has given not a cent. You know, so we have to, hopefully with the new government, the new prime minister and the new government, they will take a different approach and, you know, provide some money, because these things are so expensive now that, you know, and communities need them, as you said, for the health, and everything is intertwined. So I guess the advice that I give is just hang in there, keep on fighting. And I believe you said, John, you met with MP Batiste during the election campaign, so that was kind of a good time to get him or whatever. And you know, like I said, hang in there, and hopefully good things will come.
Thanks for that, for Councillor Patterson. Yes, you are correct. Jaime did meet with us. He actually drove from an interview in Sydney, right to Baddeck, specifically to meet with us to get an update on where we were and whatnot. And that was during the election, obviously. Since then, we've called his office this week and to set up a further meeting in the coming weeks to continue that process. I will add that under the Green, Inclusive and Community Buildings Fund that the federal government has, that we're applying for, that fund is not exhausted yet. And that's where we've been directed by the federal government and by the provincial government to make our application. And so far, that's we're still in the running in that. We haven't had any official indication of where it is. We called a couple just before the election and got a response that it's still in the review process. We have another request in to get an update, and that's in the 3 to 5 day return messaging or return response. We don't have that response back yet.
As a follow-up, Warden, the Warden, myself, Councillor Bourne, and Councillor Hennick attended the Nova Scotian Federation of Municipalities conference last week. And one of the issues that come up is just what you said, John. Navigating through these things can be a nightmare because, you know, there's so many different funds and everything. I think we could do this. We have a navigator hired by the Nova Scotian Federation of Municipalities who is an expert really on, where to find funds and so on. I think we could share that information with the committee. I don't see any reason why not. Better to ask forgiveness than permission. We'll just do it. So if you could just, one of you leave your email address and I'll forward you the information on it. And, that you got to know where to look these days kind of thing.
Councillor McLeod?
Thank you for coming. You can just check the NSFM website and the option is there to check the fundings.
Okay, perfect. Thank you.
And just a question about the ask, do you have, we've talking this about 3 years now, and the amount is getting, I guess, is getting up and up for the asking. The community is approaching, is supporting, and just for the new council, did you just want to give a little bit history about how much the province gives the municipality and how much, just the numbers, do they know what they're talking about?
Absolutely. Yeah.
Thank you.
So currently, we're proposing just under $24 million for the project, and that is with a 13% contingency. So as the years go by, obviously we are dipping into that contingency a little bit because of the cost of construction continues to go up. But our funding model, based on the different initiatives and programs that the federal government has led us down, we are proposing a 37% provincial contribution. We have the 1% $1 million municipal contribution, which is a 4%. Community contribution, we're looking at another $1 million, which is 4%. And then we're looking at a federal contribution of 55%. And that is based on the funding models that currently exist for this particular type of nonprofit project, that it is a 55% contribution.
Okay. Thank you.
Good.
Any more questions? Oh.
I'm Betty McCauley from Baddeck here. I have been involved in hockey for 50 some years. And the arena, whatever the new one may be called, is very vital for this community. As you said, for health, for young people, for older people. It is not just an ice surface. It is a lot of other things. I feel that when I first started going to the rink and my husband started coaching, there was a lot of community spirit. The rink was full. There was a lot of older people that are my age today, or that I am today, I guess, that went to the rink, supported the high school hockey, supported anything that was involved within the rink. I'm all for a new arena or center. I feel that what we have heard from both the hospital and the arena, something could happen here. May not be very viable for Baddeck or Victoria County. So I think we need to really press hard as a community as well for these two things. And just on closing, I also heard that Lewisdale is looking for a new arena at the cost of $45 million because they want to put a pool in and everything like that. So I hope we just all get on board to push hard for this facility and also for our hospital. Thank you.
Just for a comment for the new council, we during the years we meet with a Premier and Minister of Health. I think it was last year or 2 years ago. They saw that and they were like Betty was saying, NSHA was looking for spaces, so that is to be sustainable building. It's just for information purpose. The province, before they give the funding, we speak with them and we're talking about maybe NSHA or another options in office. for sustainable.
Yes, I couldn't agree more with Betty. Like, she certainly knows her way around a rink. Her husband didn't know much about hockey, but yeah. But anyway, it's an integral part of our community. I mean, that was the social building of this community. I remember going to games there. That rink had a capacity of 750. There'd be 1,200 people there. Like, it was probably illegal, but it was filled. And that just shows the amount of spirit that was here at the time. And that building did it. So we can't lose that.
We are in full agreement, and everything is interconnected. So whether it be the Cabot Trail Relay, that then the Lions Club of supporting that then helps fund the island programs in the summer. I mean, it's all community, it's nonprofit. We truly believe in the project, which is why we've been fighting for it for years. And we do believe that we will get this to the finish line. And we continue to have very positive conversations with the federal leaders, but we do continue to need your support and the community support, and to ensure that this is still, I mean, a talking point in terms of priorities. So that when they ask, what does Victoria County need? We need spaces like this. We need infrastructure, recreation. It's something that we need, and they asking for their support constantly.
Hennick?
When did you guys initially start this project?
It was a little over 5 years ago.
5 years, so you haven't heard anything from,
So I'll give a little bit more background on how the project came to be. Okay, how the project came to be. So initially it wasn't for a new rink. So the rink board at that time, they saw that there was challenges with the current rink. So there was accessibility for females, and we needed more dressing rooms and other things to make the actual building accessible. So at that point, explored opportunities to revamp things, to do a small expansion that would at that point just be a community funded thing. As we went down that road and then had the structural engineers in, that is when we then uncovered structural issues. So at that point, then we went down the road of exploring option A, B, and C. So whether it be a Band-Aid solution of how long that could maintain the current building, there was then doing a bump out and seeing where that could take us. And then unfortunately, with all the research and the numbers and what it made sense for long-term solutions, the recommendation came forth that it was best to pursue a new facility. And that new facility, not just being a rink, it being this multi-purpose that has the walking track, it has the community spaces, so that it can appeal to a larger audience, but then still be an infrastructure piece of space for the community itself. So at that time, that's where we are 5 years ago. And then in terms of pursuing money for the new facility, that's probably more in the 3-year range. And from the very beginning, they said that the process we had to go down was get the municipal support, get the provincial support, get the federal support. And all along, they said, they said municipal will be the hardest because it's the smallest, then the provincial, and now we're at the federal. So we are at that finish line, but it is the biggest piece of the puzzle. So it is that 55%. So until we have that commitment, we can't start, but we do have all the pieces that they have told us to go get.
Perhaps council should look to see to have MP Batiste come in to council, see if there's any type of update.
Okay, take the recommendation and motion.
Yes.
It's a motion for a letter to Jaime Batiste MP to come to council and have a chat with him.
There's a motion on the table. Do I have
I
a
will second that.
second by Councillor Carr? All in favor? Motion carried. We'll get Steph to send that out. Okay. That's it.
I'd just like to take 1 minute just to thank the council for how supportive you've been and the previous council that really jump-started this. You heard Jeannie say that the hardest commitment was from the municipality. The municipality came on board after a lot of questioning and support, and that really made a difference. And thank you all for that support and continued support.
Thank you. Thank you for coming. Next, we have a presentation from North Highlands Nordic.
My paper. Oh, no, there it is.
Good afternoon, ladies. We're going to get the counselors to introduce yourself, then you can introduce yourself. We have 20 minutes. We're trying to catch up. We have a long day. We have two more meetings after this. Sorry. So in that 20 minutes, it'll be for you guys to talk and us to ask questions. And okay, I'll keep you on track. Look. Anyways, start here with Councillor Matheson.
Good afternoon. I probably don't need to say where my district is again, but good afternoon. Welcome. I'm Donna Matheson-LEFORT, District 1.
Hello, Perla McLeod, District 2.
Welcome, ladies. Jessica, District 3.
Good afternoon. Fraser Patterson, District 5, which is the other side of Kelly's Mountain, basically.
Welcome, Rosella Bourne, District 4.
Ladies, I'm in District 8 and Wanda Hennick. So, yeah.
So know me, Jackie Organ, District 7. Start. You can introduce yourselves.
Good day, ladies and gentlemen. This is Paula from North Highlands Nordic, the president, and I just want to thank you for taking the time to listen to our presentation.
And Cheryl Dixon, a volunteer from North Highlands Nordic.
I'm Katie Fitzgerald. I'm the manager of North Highlands Nordic. Good morning and good afternoon, and thank you for meeting with us today. I'm the facility manager, and I would like to thank my president, and we were hoping to have more volunteers today, but it didn't work out to have a larger number representing us. We are always so pleased to have so much community support behind us. We are here today requesting funding. We're looking for $125,000 from Victoria County to expand the footprint of the North Highlands Nordic garage and rental office space to accommodate the new groomer. In 2020, Victoria County was instrumental in funding phase 1 of the NHN Nordic Center. Originally, the garage was designed around the size of the previous groomer. And the beautiful new piston bully groomer that was funded by Victoria County, ACOA, and the province is significantly larger. It's a much larger machine. This has drastically affected the usable space, storage of equipment and supplies, maintenance of the groomer, and the safety of staff and customers, and the overall functionality of the Nordic Center day to day this past winter. And safety is our #1 concern. The new groomer is larger in all dimensions, width, length, and height. Due to the size increase, the laneway through which patrons walk to access the ski equipment and then continue to pass along to access the exterior door has narrowed significantly, and this restricts ease of movement and is a safety concern if we would need to evacuate the building. In 2022, Larry Maxwell was instrumental in helping us acquire a four-wheeler. It was an emergency response tool, a backup tool for grooming the trails, and use for year-round trail maintenance. This is also a very large vehicle, and there's a large grooming attachment connected to it as a backup measure for grooming the trails. There was barely enough room to accommodate both of these pieces with the previous space, with the previous machine. In the event of an emergency that requires using this four-wheeler and potentially the emergency sled, also very large and heavy, they both are housed in the garage with this new groomer, and that groomer has to be taken out of the garage in order to access the other vehicles. And we only have one person trained to drive this new machine. That makes it very difficult to make an emergency situation executed quickly and efficiently and safely. There is no longer storage space for the snowshoes. Racks have been relocated to a wall in our office to deal with the current space situation. The office space allows for only half of the inventory to be readily available. Accessing the rest of the snowshoes requires the manager, staff, and volunteers to climb around the groomer blade, which is unsafe. And not only are we maneuvering over and around the blade, but quite often because of conditions, the floor is wet because of snow and ice melt, which makes it very slippery. Because of the additional length of the new groomer, the track setter pans must be stored in the upright position when parked in the garage. This makes maintenance of the groomer more difficult, as the doors need to be fully open when performing maintenance. The pans have to be lowered to the floor. This results in heat loss and added expense to our operating cost. The other option is that the groomer would need to be completely removed from the building and to be worked on outside, which is weather dependent and can be very inconvenient for a volunteer. Adding to our space concerns, again, due to the size of the new groomer, all of the ski pole racks had to be relocated to an area inside the garage that had been previously designated as a ski waxing station. It has been very difficult to navigate meeting this need for travelers this past winter, and that loss of space has been, significant to our facility. It's been a setback. Additional storage is required for items that are needed by the new machine, things that are being used on a regular basis, factoring in all of our other day-to-day required storage for tools, shovels. We have large handmade photo booths that are used outdoors that have to be housed during the summer. All of our signage needs to be stored as well. We no longer have the storage space in the garage to accommodate everything. The day-to-day functions of the Nordic Center with regards to the rental office and the Nordic Cafe, as well as other fundraising efforts we do inside the building, they require tools for cleaning, bins for storage, waste management, and equipment for our youth programs. The garage was not large enough to really accommodate all of these items previously, and we've had to find creative ways to be able to incorporate all our space of the whole Nordic Center. That means we have extra clutter. So all of that extra clutter has created a safety hazard. It's also very unattractive. We want the interior space to be warm and welcoming, inviting and clean. Expanding the building will create dedicated space to address all of these concerns. Elaborating on these points, it is important to the board and staff that the Nordic Center, again, is always looking its best. We want to show the love that our community, the volunteers, the county, and the province have put into this facility and are continuing to put into the facility. Beyond our safety concerns, we would like to ensure that there are more events hosted at North Highlands Nordic in the future to bring more winter tourism to Victoria County. We've had the incredible honor to be asked to be a venue for the 2028 Special Olympics, hosting, yes, it's very exciting, hosting the cross-country ski and snowshoe competitions. This is an amazing opportunity for us and for Victoria County. We will be increasing public knowledge of what we can offer for winter tourism and bringing more revenue to the county and to our local communities. We're also going to be hosting the 2026 Nova Scotia Provincial Cross Country Ski Championships. This is very lucky for us. We were supposed to host last year and we lost the event due to an unforeseen blizzard, which was a good loss of revenue, unfortunately. We had 3,189 guests in 2024. This past winter, we had 3,164. So the loss of the provincial championships shows we lost close to 200 people attending that weekend. We would have had, pardon me, competitors, families, spectators, race officials, coaches, and customers coming to ski recreationally. We have more plans of our own to host special events and races throughout the season every year moving forward. Your generous contribution to the expansion of our building now will allow us to focus on all of these other improvements, working towards these prestigious events. Having a designated waxing space is imperative. Having more interior space to accommodate our guests, separate storage in the garage to house waste, cleaning supplies, etc. Again, to keep those interior spaces clear of clutter and looking more presentable. We have quotes from 3 local building companies on the cost for this expansion. I've included handouts with all of those details. The quotes range from $125,628 to $168,360. The last 24 by 24 construction on phase 3 of the NORDIC Center cost approximately $140,000 in 2022. The quotes account for inflation on cost of materials, as well as variance in labor cost. Our building plan will add a 24 by 30 extension to the original garage structure. This expansion will allow the footprint of the rental office to expand. All rental equipment can be safely stored in the office. The garage will not be accessed by guests unless we're using the emergency exit. The loft space above the office will expand to allow even more storage and organization solutions. The accessible washroom will be decluttered, safe and accessible again. There is potential to expand the second washroom located in the office prior to the 2028 Special Olympics, which will give us 2 accessible washrooms. I would also like to note that from Neils Harbor to Chebucto, we're the only washroom open all winter on the Cabot Trail. Having dedicated storage space for our supplies and waste management will allow the NORDIC Center to continue hosting fundraising events year-round in a clean and safe space, being more comfortable and allowing for room for our guests and volunteers. We would like to make sure you understand who we're serving and how we're serving them. To ensure inclusivity, we offer very affordable daily and season rates, as well as half-price rates for school field trips and special groups, removing barriers to access, and we do not charge tax. A family season pass for one household is $400. This includes access to our Groom Trails daily and all rental equipment daily for the entire season for every person in the home. We do not charge a daily or season rate for preschool-aged children. They're free. We are fortunate to partner with the Lions Club. They purchase 2 family season passes every year to give to deserving families from Ingonish to Meat Cove. An adult daily pass is $20. A youth daily trail pass is $10, and the rental price is the same for each. It's important for us that these prices don't change so that we can continue to offer a more affordable activity for people year-round in our community, in the winters in our community. We are registered with Cross Country Nova Scotia and Cross Country Canada. We had 143 registered members for the 2025 season. We were also very excited to partner with the co-op program at the Cabot Education Center. We had 2 students on site for 80 hours learning about how a nonprofit organization runs, how much community interaction we're involved with. We're looking forward to hosting with them again, partnering with them again. We believe we offer a unique experience to all of our visitors. The high quality of our Groom Trails are tailored to the comfort of new skiers and experienced skiers alike. We know we're providing a safe space to enjoy recreation, being active, healthy living for body and mind, and encouraging our communities and people coming together. We were pleased to host field trips with the Girl Guides, Notre Dame Academy from Chebucto, and Cabot Education Center. We were hoping to also host the 2 elementary schools from Ingonish and Aspey Bay, but winter had other plans for us. including the staff of the municipality of Victoria County. Winter influenced the early end of winter, made us have to reschedule that event for you. Due to the high quality and consistency of our trails, we have many seniors enjoying skiing and snowshoeing daily who may otherwise not have been able to be as active in the winter months. The Nordic Centre is a welcoming space for everyone, not just members. It's especially important to note we have a lot of visitors who are not interested or able to be physically active. The interior space is comfortable for them to relax and enjoy socializing with the community and to take part in activities such as food service events at the Nordic Cafe, Chase the Ace, a fundraiser that we partner with the North Highlands Community Museum for fundraising. We offer open houses every winter with free food. We've had local music pub nights and the mobile library visits a few times a season. The youth programs, Jackrabbits and Bunnies, had wonderful attendance this year. Our season report, the year-end report, is included with the package I passed out to everyone. It has more in-depth details of our community presence. We are prepared to continue working very hard on all of our fundraising efforts for this project with the continued support of everyone here at the municipality of Victoria County. We would like to offer more to our surrounding communities. We hope that you will continue to invest in our organization and know how deeply we as a community are proud to represent our county and to be an integral part of the solution for increasing the local economy, winter tourism, and active living.
I would also like to add on the quotes you have there, it doesn't include, we have the big main garage door and it's not in the quotes. So we have to get someone else professionally to come and do that, which is on top of that, it will be another 3,000 to 4,000 just to have them moved. And the fact that we need to have them all together. Like I'll give you an example, like this past winter, twice there was an emergency out on the trail. Someone got hurt and we were not able to get the equipment out because no one was qualified enough. Because Jamie, the technician, was not there because he does all the grooming at nighttime, so he was gone home. So we couldn't get our emergency equipment out to get these people. So, well, luckily we had a couple other skiers that helped bring her in. Mm-hmm. And then there was another instance where there was a young lad that went out on his own, left his parents, and they didn't know where he went. And so we couldn't get the equipment out again. And so we had to rely on, everyone going out and skiing, trying to do all the different trails to try to find this lad. So to me, it's very much important for safety-wise. And to have, like, if we were just to add another building aside, I don't think that would be feasible because we need so much room for it. And if you add where our location is, if you had come to see, we have no room to just have a shed there, another big shed, and then we still have to work around that because of just where it is, and that's the plain fact. So to me, it's very important, especially for all of our staff inside. They can't get around this big equipment, which we had no thought that it was going to be that big. And I would love to have you down. Come on down and have some crab sandwiches, and I'll show you. I just want to thank you very much. If you have any questions, please ask us.
Thanks, Paula. Any questions from council? Councilor Patterson.
Thank you, Horton. Yes, I was the one that comment on crab sandwiches. You had bought a plate today, I'd be all in. Tell you right now.
Oh, geez.
Anyway, second thing I'd like to congratulate you on. I've sat here for many a year when people come in and give a presentation and then they leave and everybody's looking around. What did they want? Well, you told us in the second sentence what you wanted or whatever, and that's we're starting there. That's a good thing. Just finally, and I guess this is kind of what's possible. I was in Prince George, British Columbia a year ago last March, and they were hosting the World Paralympic Games. And amazingly, the biggest contingent was from the Ukraine. So, I mean, that's what I said. You can dream and think of those things. That's that brought more into that town than you could probably measure, right? It was incredible. But I mean, you have to have the facility and of course the volunteers. That's the big issue. But that doesn't mean you shouldn't you shouldn't dream of it anyway.
Well, there is
Yeah.
one athlete with the the Nova Scotia cross country ski team who is a para athlete, and she's been competing at a world level and is one of the kids who comes and trains at our facility. It's amazing to watch her ski.
Yeah.
Yeah.
Yeah. Councillor Matheson-LeFort.
Well, again, I just as someone who doesn't know what the process is, what is the process to attract or secure events such as the Special Olympics? Or are you in a database and a larger body contacts?
It's because we're under the umbrella of Cross Country Canada and Cross Country Nova Scotia. And we are honestly one of the few facilities that has guaranteed snow every year. 2 winters ago, we were the only facility in Nova Scotia that had consistent snow, and we had a lot more people coming from Halifax and around the general mainland area coming to ski. So because we are also the site that hosted the 1987 Jeux Canada Games, those trails are very well known in the ski community, and we use our social media to really push what we have, and it's expanded remarkably in the last couple of years how far we're reaching with that.
Another question, if you don't mind. What do you do? Is it like partnering with, I guess, with, the municipality? How do other districts in a municipality like mine's the farthest away probably in District 1. What do you do throughout the county to try to promote? Like, so someone who just moved back to Canada, I wouldn't even know about there. So if somebody was to ask me in my district, what do I have for like literature to be able to give them, or just send them your way Facebook page or
Facebook, Instagram, debating on whether or not to start a TikTok account. I think that might be not necessary, but we're so lucky that a lot of people really do know. I am talking about NHN all the time. I see people at the Co-op or the Superstore in Sydney, and we get to chatting. It's like, oh, come up our way in the winter. It's fantastic. Ski Cape Smoky has been really fantastic to promote us as well, sister ski areas. So if you're coming up for a weekend getaway and you know that you want to go downhill skiing and you can see on their social media what we're doing, have a day at Smoky. Maybe when it's a bit windier or snowier, come down to North Highlands Nordic. Our trails are very sheltered. We also offer a different level of impact. So not everyone is as, daredevil-y as people who want to go crazy downhill. And we get a lot of families who are looking to travel in the winter. And I'm so amazed at how many people come from Sydney and the surrounding areas. We do interviews on the radio as well with Information Morning and public service announcements to let people know what we're doing.
And we also have Cape Breton Nordic and
that's right.
and the Baddeck Nordic that we communicate with, and everything is passed through that. And we have a website so everyone can see what's on the website. So we put the word out there and we get around. And I mean, I do a lot of volunteering, as Wanda knows too, that I'm out there fundraising all the time.
Yeah.
And I try to get the word out everywhere. And that's the main thing. We love our community down there. We want people to come and see what a beautiful place we have. To inspire them to come and get out and do an activity is amazing. If you went on our trails, you would love them. Even snowshoeing. A lot of people, have a hard time with skiing, which I'm one of them. But I'll snowshoe, and it's amazing just to go through all those trails and go out in the red trail, they call it, and the mountain view is amazing. So I just think it inspires people, and you can feel like it's just a different energy altogether. It's a healer too, because I have people that have a lot of tragic deaths in their family, and that's one thing that brings them in, the mental stability of just coming out and socializing with everyone. It's amazing.
Like you can breathe.
You can breathe. Yeah.
Councillor McLeod.
Yeah.
Thank you for your update. We recognize that it's very important your organization in 2024 in October we gave the $124,000.
Yes.
Right now you're coming with and asking with $125,000. My question is, do you search any funding available around that with any organization, any funding?
I did.
Yeah,
I did. I went to COA, and they do not do the extensions, like expansions. They have no funding for that. And I went to the province, and which their grants are all closed right now, and I can't get no funding there.
Do you apply for the community grant?
The community grant?
Yeah, here in the county.
For the community grant?
Yeah, but yeah, I know, but it's the asking is it's a large one, just in one sum, $125,000. We just gave 124 in October.
Mhm.
So I don't see any nobody's putting labor or funding.
I was told that not to, I didn't have to put an application. Is that what you're looking for?
But yeah,
We were asked to present in person because we were
person?
asking for a larger sum than the grant was allowing for.
Yeah.
do you? Yeah, okay. So you're asking for the $125,000.
Yeah.
The organization is not putting any money for.
We are putting
Yep.
money in. We are.
We are always fundraising.
Yeah.
How much you putting for that?
We're going to put approximately $6,000.
Okay. Yeah. Okay. You say you have the Canada Games in 2028?
The Special Olympics.
Special Olympics? Okay. And so you need this because the new room is not fit in your building.
That's right.
So I understand because it's new, but it's not really an emergency one.
It is emergency.
But it's an emergency kind of, but but it's just, I'm talking about the amount, right? It's only 21,000. We just finished budget and we have recommendations for budget. The only way, in my opinion, would say if that 125 could be in a couple of years, in 3 years, but if you are, just to make sure you will need the money.
Yeah.
Full 125.
Yeah.
Okay, thanks.
But at the same time, we understand that is a big ask. We will be doing a lot of fundraising ourselves. If you can't give the full amount, if you can contribute something to help us, we're not going to say no.
Okay, thanks.
Yeah, so I'm just going to comment on the why it wouldn't have gone through the community grants. So we have parameters for the first phase of going through the community grants applications. So $140,000 would have been outside of the realm of what our community grants would be for. So it wouldn't even have been considered because it was outside the ask, because the biggest capital ask is 20,000.
20,000.
So,
okay.
So Bourne?
Thank you for coming today. That was an excellent presentation. And I will say that I know you have a lot of ambassadors within Victoria County, and I think Nancy from your area also, so we hear a lot of great things. I think Councillor Deputy Warden asked a few questions that I had, but when it came to 2022 with the 140,000 for your build, can you share a little bit about who contributed to that amount, like provincial, federal? Was it a COA?
Yes, there was 3. There was a COA and there was provincials. You mean for last?
That was the 2022 phase 3?
Oh, the 2022, the provincial, because it was a couple of years. It's hard to recognize, but we started building in 2020. And so every year we were putting into the grants. And so then they would give us so much back. And that's how, and it was mostly the provincials and the county was giving us money, and our COA was giving us money towards it all. Yeah.
It was more economical for us to have 3 phases of building construction.
Yeah.
In order to fundraise enough to help cover our end of the cost.
Yeah.
So instead of building one large facility that would have cost a lot of money, breaking it into 3 was what was suggested to us by all the branches of government to help.
Great. And the other question that I had, I just have 2 more. For the space, I know you had shared that it's better to add to the present space that you have.
Yes.
Did you have a professional consultant advise you on that?
Yes, well, it was the technicians, the groomer guys, they feel that for security wise and safety wise, it would be more logic to have everything stored in one building. And the thing was too, is that we don't have the property to be able to store all that stuff in front of it or even beside it. It's all the trails. So that is the only area that we could do it.
And then finally, with being a nonprofit, you would get a portion of your tax back, correct?
Yes.
So that would be, I just wanted to question that as well, just with the taxes.
124,
No, I mean, if the quote came in,
Oh,
the
yeah.
the
Yes.
HST portion.
HST, yeah.
You would get a portion of that back. Okay,
Yeah.
thank you.
Well, thank you, ladies. We just went over our time a
Yeah,
little
sorry.
bit. Great presentation. And council will have to discuss this
Absolutely.
and
We appreciate you taking the time to hear us today.
For sure.
thank you.
Thank you, ladies and gentlemen.
We're going to take a 15-minute recess.
For sure.
We're back. We're going to go right into district highlights. We'll start with Councillor Hennick.
Alrighty, starting off in my district, I would like to say starting tomorrow, May 6th, in the community of Dingwall and Cape North, their community cleanup will start. Bay St. Lawrence Community Center will hold theirs Wednesday at 5. Oh, I'm sorry, everyone will meet at the Markland at 3 o'clock for the Dingwall and Cape North area. Sorry about that. Come out and clean our beautiful community. We'll all be there. So give us a hand if you can. The North Highlands Community Museum will be opening June 1st, and with their air washrooms being opened on May 11th for their surrounding communities, if they want to know that air washrooms will be open. An update on the Bay St. Lawrence Community Center. Cleaning is complete and they are moving along quite quickly. So I'm hoping to get an update from the coordinators there on an official date when they will be opening to the public.
I received an update from Amy McKinnon on the health fair that was there on April 30th. It was a big success, and the health fair was not only a day of health promotion, but a powerful reminder of what rural communities can accomplish when leadership, hard work come together. They had 27 service providers present. Really brought a real support and solutions to people across generations. They had many valued partners from provincial departments to local organizations to local government. This event would not have been happened without the leadership, planning, and resultness of community and commitment from the Bay St. Lawrence Community Center. Rural organization like theirs carry out the full weight of community wellness without recognition. This is further provides that they are pure participants and drivers in our community to make the health initiatives in our district. They had several successes with the organizations that were there for steps for people that needed support. The Cape Breton Business College Dental Assistant Program pledged that when their local dentist office open with Mr. Burns, they will join every visit to provide free cleaning and oral health and oral education. This could, be very well dental care in our local community and district. We are grateful to all the partners, but even proud of the deep local leadership that continues to go unrecognized in places like Bay St. Lawrence. Let this event serve as a loud and lasting example of what we do every day. Whether people are watching or not, it's a very viable asset to our district. I think that was it. Health fair, and a safe fishing season to all the fishermen this season when they start fishing next week. Thank you.
Thank you, Councillor. Councillor Bourne?
Thank you, Warden.
On April 16th, I held a public session at the weekly gathering in Indian Brook Fire Hall as the District 4 councillor. The session was very successful and I engaged with nearly 40 residents, conversations, priorities, and opportunities that will strengthen our community. On April 26th, the Smoky Food Drive. I attended the South of Smoky Food Drive. It was a well-supported event that brought the community together in support of those in need. And I just wanted to put a heartfelt thank you out to the Baddeck Volunteer Fire Department, the Lions Club, and the Knox Presbyterian Church for their dedication, as South of Smoky Food Bank plays a vital role in supporting residents throughout the county and especially District 4. It was touched on today on May 7th, which is the upcoming expo for the healthcare, which will be at the Inverry Inn between 6 and 8. On May the 8th coming up, there is going to be a community benefit dinner at the North Shore and District Volunteer Fire Department. This is supporting a neighbor who lost their home in a fire. The community is coming together for a benefit dinner at the North Shore Volunteer Fire Department. So if anyone is interested, that'd be great. And then ongoing community concerns. I'm still getting emails and phone calls about the St. Anne's Look-Off garbage and the Bay Road flooding. These are ongoing issues, and I have brought both of these concerns formally and submitted them to the Department of Public Works. And I do have 3 motions, if I can read those off. The first motion, that Council formally requests the province of Nova Scotia to withhold the development of fracking until a transparent, evidence-based studies on environmental and public health impacts are made available to municipalities and the public. Meaningful consultation with municipalities and First Nations has taken place, and that Council can send a letter to the Premier of Nova Scotia requesting this precautionary approach and emphasizing the need for full and transparent disclosure and risk and consultation process.
There's a motion on the table. Do I have a seconder? Second by Councillor Kerr. All in favor? Against? Motion carried.
Thank you, Warden.
The second motion is that council send a letter to the Assembly of Nova Scotia Mi'kmaq Chiefs and Wagmatcook First Nations, thanking them for their leadership and advocacy on environmental issues, including the hydraulic fracturing, expressing our solidarity and shared commitment to protecting the land and water resources for current and future generations.
Motion on the table. Do I have a seconder? Second by Councillor Matheson-LeFort. All in favor? Against? Motion carried.
Thank you. And finally, that council send a letter to the Nova Scotia Federation of Municipalities, the NSFM, encouraging them to support municipalities and advocating for more information and transparency on fracking and to uphold the principle of informed local decision-making.
And on the table, do I have a seconder? Second by Councillor Hennick. All in favor?
Thank you.
Motion carried. Councillor Patterson.
Thank you, Warden. Just a couple of short things. Just echoing Councillor Hennick's comments about the fishermen. In 10 days, they'll be setting out on the briny, as they say. Wishing them good weather and good prices. I think it's going to be interesting to see how the tariffs from China affect the fishery here. But anyway, we'll just have to wait and see what the price will be. Secondly, a grader was actually spotted and filmed on the Kemphead Road, big yellow machine. It wasn't the school bus, and also on the New Campbellton Road. Whether this had anything to do with the minister's meeting we had with the Honorable Fred Tilley or not, I leave it up to your imagination. But he did text someone saying that the grader would be there the next day. Anyway, so I guess Steve McDonald did mention that they were going to be doing more grading than they had done in the past. So I thanked him for that, and hopefully the worst of the season is over and the gravel roads will stay fairly good for the summer. And finally, I don't know, maybe you all know this, but the Honorable Keith Bain is presently in hospital, and I was just talking to MLA Timmons earlier. He's in the regional. He went in sometime last week, I believe. I'm not sure of the day. But anyway, if any of you know Keith, and if you happen to be in Sydney, you could drop in to see him, or I don't know if he has the same email address he had before or not. Maybe you could just, if you want to email him, just email Diane's office and they'll forward it. And then just that we wish him all the best and hope he's back out and doing his community things as he's always done all his life. That's it. Thank you.
Thank you, Councillor Kerr.
Work is slated to commence on replacing the boardwalk on Water Street next week, which is going to be great to see this project up and going. It's well needed right now. Our local volunteer hospital group, as you could see earlier on, has started up, and they've done a fantastic job, and they're really eager and are going to continue to push to get our ER open again. Also, our local RINK group, which was here as well, they're nonstop going. They're just done a fantastic job so far, and I wish them all the luck in the world. And our business organizations and residents are working hard getting ready for the Cabot Trail Relay Race, which is going to take place the end of this month. So there's a lot of prep work has to do, and everybody's going off in about 10 different directions now, but that's like many other years, it'll all come together and it'll be a great success, we hope. So thank you.
Councillor McLeod, sorry.
Not at this moment, thanks. Nothing. Good.
Councillor Matheson-LeFort.
Okay, I'd like to start with saying that everybody in my district is very, very happy that there's some of our seasonal businesses are have opened or are opening back up. So I'd like to put a mention out there about Darby's Orchards Kitchen is now open in McKinnon's Harbor, which is making everybody very happy. Number 2, the Harbor Greenhouse will be ready for business on May 8th. The Sacred Turtle will be ready for business, opening up in their new location in Jamesville, May 10th. And I also wanted to congratulate again the Iona Volunteer Fire Department on their 66 years of service. They had a dinner and an award ceremony for 25 years and 35 years of service on April 27th. So I wanted to say again, congratulations on that. And that wraps up my district. Thank you very much.
Thank you, Counselor. This is not in my district, but I just wanted to start by saying yesterday was bereaved Mother's Day. I just wanted to take a moment to recognize all these courageous women out there. Please keep in mind today for Lily and Jack Sullivan in your thoughts and prayers that they'll be found safe and sound and brought home to their family. The community cleanup will be announced soon. It'll be probably the May long weekend. I'm just waiting for the family to organize that. Heavy pickup went pretty good. There are a few items left out, but I in my district, I will be contacting them because they're like putting it out. And I had the privilege of yesterday to present a check to the Neils Harbor New Haven Development Association on behalf of the county for $100,000 for phase 1 of the lighthouse project. They were pretty happy to receive this money, and it's going to a very good cause. And that's it for my district. On the agenda will be council meeting discussions. This is to discuss our meetings and meeting times. So if anybody wants to say anything about our meetings. Led by Steph McLeod here. We're just waiting for her.
Yeah, so this was a request from council. You guys wanted to look at changing up the structure of council meetings, which staff are happy to do. It is a direction of council, though, which way you want to go. I've heard a number of suggestions. You want to break up committee of the whole and council. You feel like you don't want to do it all on the same day. I've heard different times. So it was requested that you guys send in your suggestions. Thank you to the councilors who did. So this is basically your discussion. We can certainly put some input in, but yeah, it's your discussion and your decision at the end of the day how you want to see council rolling out.
Anyone? Oh, Councillor Bourne.
Don't mind starting the conversation. So I just find having the committee of the whole the same day as council plus presentations and other things that might pop up a very long day. And I think for me, I'd like to give both the committee of the whole and council my best attention in both. So my suggestion that I presented was just to have the committee of the whole 1 week prior. And that way we just would need 1 week to digest the information and we can move that forward in council. But that was my suggestion. Plus, just it doesn't really matter, but one of the other things I mentioned was for maybe having a few evening sessions throughout the summer when it's more daylight. But that was just a suggestion that I put through.
Patterson?
Thank you, Warden. Being the oldest member around the table, I guess Councillor Bourne kind of indicated too, it's a long day, especially not for me because I'm old, like I said. You know, we back up with 15 minutes for lunch. I mean, that's not accessible anywhere. I don't care. You need some time to get away from this stuff, sit down and ask about people's pets and kids and so on, and have a little bit of social activity over the lunch, hopefully. Maybe even off-site, you know, just get out of the building. One thing about teaching school, and Donna, I don't know if you agree with me or not, one of the best parts of the day was just getting away for 40 minutes and just escaping. You know, sometimes it can be a loony bin or whatever. Not that here's a loony bin, but, you know, it's just to get that break, give your mind a break. And the other issue, of course, is everything gets backed up because you can't schedule a council meeting for 2 hours and expect it to not go longer. Because that's why we're here, is to talk and discuss and debate things. And you really have to leave it open-ended. So I would suggest this kind of, the other thing is just look outside today. This is one of the nicest days we've had. I think all of us would rather be out doing something in our backyard than sitting here for the whole day. So I would suggest, as Councillor Bourne said, splitting them up, the committee of the whole and the council. Maybe in the morning, but maybe in late afternoon as we used to meet at 5 o'clock. Committee meetings could be scheduled interspersed in there. And the other issue that we're having is scheduling Alderwood meetings. And we always used to schedule them on the day of council. And it saved the trip. We got to meet and so on and so forth. So not saying we should, I think it's something to look at. I don't know if we have to do that again or not, but it's it's something we could have a look if it's feasible to do that. Like again, it's just a long day. Split it up a week or two. Councillor, I don't know if you have any lapse in mind between the two of them, whether it's 1 week or 2 weeks, and then I think we'd be more efficient. We could schedule speakers then, and if it goes over time, a few minutes or whatever, it's not going to back us up for the whole day. So that's my 2 cents worth.
Warden Organ, if I may have a point of clarification for Councillor Patterson. So Eve, are you suggesting a 45 to an hour long break for recess, even if we keep council just at council that day?
It depends on the meetings, I guess. That if we have, let's say we have council at 9 o'clock, schedule it till 12 because it's going to take 3 hours. Then you may have a committee meeting scheduled at 1. Okay, and if we happen to finish at 12 or before 12, like I said, just a chance to get out, get away from things for a bit, and get your thoughts back together.
A committee meeting or a committee of the whole meeting, just a committee meeting in general?
Well, if you have a council meeting one Monday, let's say, a week or two later you have the committee of the whole, or reverse. Then you may have committee meetings. We may have an Alderwood meeting at 1 o'clock that afternoon, right? Or there could be Victoria County Transit or whatever it happens to be. I'm saying allow an hour for lunch.
Thank you.
Councillor Matheson-LeFort.
I also submitted something similar to what Councillor Bourne did. If we have the cow approximately a week before our council sessions. Again, with me, I probably go straight for 24 hours doing something. I just don't think we do the work justice and the matters that we have to address. We give it our 100% if we're going that long during the day. That's my biggest concern. So, and I wouldn't personally, if we were to wrap up a session by 12, I wouldn't be around for lunch. I would just go. That's how I'd work it, unless we specifically had something in the afternoon. Thank you.
Councillor McLeod.
Yeah, I'm with Councillor Bourne, like a week prior, the cow. We can sketch some extra meetings, training, BCT, any of that for couple hours to make the day worth. And after, after the week, the council meeting, just council meeting, and because maybe presentations will be longer. About the time, we do in the last formal council. In summertime, we just meet in summertime maybe once because everybody is busy. We understand that. So sometimes I don't know if we was doing cow either, but because everybody's busy and it's a vacation for everybody, so we can just do 1 day a month for meetings. The council, and that's it for the month. And in winter time, because the people traveling in north is for the weather, we prefer to do it early. So I'm open whatever the time, and with that lunch doesn't matter to me. Like you say, if this is only council, I'm just going home too. Or yeah, so it's just it's a matter to make lunch.
I'm in agreement with this as well, that have the committee of the whole meeting on one week and the regular council meeting on another.
And do you want to continue with committee of the whole meetings for the summer, or, excuse me, or as Councilor McLeod mentioned, in the past, we have typically had one meeting of council, and that was a regular meeting of council a month for the month of July and August, and that is the only time we met, unless there was something that came up.
I think maybe if something come up, we can meet, of course. Like we are available anytime, right? But if something is urgent and we need to do something, well, we can plan in that time. It's open, but not have to be like a, you know, in spring and.
Okay, so to summarize this, what I think I've heard is a 9 to 12 scheduled council meeting. The week after, a 9 to 12 committee of the whole, possibly, or committee of the whole plus meetings, which would be wrapped up at lunchtime. And then if there's extra meetings, start them at 1, that the committee of the whole day.
Deputy Warden alluded to it. Wanda and Jackie, are you happy with 9 o'clock, or would you rather be?
I could be here for 6.
Okay, well, don't let her have any say that it's going to be here at 6. Wanda, you don't mind at 9 o'clock?
8, like as some folks said, like some of them are all busy, like I run the meeting also, so I mean, I just gotta know the dates.
Yeah. And I think available, like you know, if something come up, we can arrange the day or the you know, in the morning or maybe in the afternoon, but it's just in that time, like but yeah, you know.
Oh, so did I summarize it around?
I think we had, we were talking about committee of the whole a week before council
Correct,
session, right?
yeah.
And not the other way around.
Yeah.
Okay. Yes.
And that will, so our last, technically then our last committee of the whole meeting will be May 26th. That's already been scheduled. And so we will take a break from committee of the wholes for the months of June, July, and August. And then I just wanted to bring up to council as well that it was suggested, since committee of the whole meetings are no longer live streamed, or they were never technically live streamed, but except for one, that would give us the availability to move around the county. So I'm happy to take suggestions on that. And if you guys are still wanting to do that, I will leave it at council direction to kind of come up with who wants to do it in their district first. And also you'll have to provide me with the space. You know your districts better than I do. You know your contacts better than I do. So you'll have to provide me with that information when we're booking that. But we can do that starting September. Go ahead, Councilor Moore.
What time works best for you? Because I think we're pretty flexible. Like, would it be easier to schedule it, council meetings a little bit later, like in the afternoon?
It makes no difference to administration at all. No, it's whatever works for council.
That's exactly what I was going to ask. Yeah, I mean, I think we're open to that. Just to separate the two of them is probably the most important thing.
Yep.
So I was just thinking also, it may even be an option because you're traveling the farthest and like you said, everybody's busy. Maybe one of those summer ones could be a virtual one so that you're not taking up that extra time too. Might be an option.
Do you mean COW or committee or council meeting?
So we're only having council in the summer.
Okay.
So we might take a poll maybe beforehand to see if what works best for everyone.
So nothing's scheduled yet. We haven't put out that schedule, so it's good. I won't have to make any changes because it's not done yet. But yeah, so I think, yeah, going forward, we won't start planning committee of the whole schedules until
probably mid-July. And then we can go forward with that. But so everything is the same until for May 26th will be the same.
Okay, so I think we have some direction on that.
Yep, correct. We'll
And then
yeah.
June 16 will be council again, and then we'll figure out the schedule after that.
Yeah,
Okay,
yeah. So we'll have one more long day.
Yeah. Okay.
At the end of May.
Clear as mud for everyone? Okay.
Got that?
Okay, now we move on to motions and resolutions. Councillor Matheson-LeFort, you are up.
Thank you, Warden. And make sure you have your gavel at the ready to wake people up, just in case anybody nods off. Okay. I am putting forth a motion to reduce litter and illegal dumping in Victoria County. The objective: to initiate a multifaceted project aimed at reducing litter and illegal dumping through the development of bylaws, public education campaigns, and partnerships with regional stakeholders. Whereas various groups and individual residents throughout Victoria County have expressed concern to council and staff regarding litter and illegal dumping, and whereas litter and illegal dumping have detrimental impacts on the environment, public health, and the economic vitality of Victoria County, and whereas the Municipality of Victoria County's Strategic Priorities 2023 to 2025 identifies preserving our rural natural beauty as a key strategic goal. And whereas the Strategic Priorities mission affirms that Victoria County provides and advocates for services and resources that enhance our quality of life and our natural environment so that all residents are proud of where they live. And whereas the latest provincial cleanup guide recommends municipalities create or amend bylaws to include enforceable provisions against illegal dumping. Now, therefore, be it resolved that Council direct administration to develop a public survey to engage stakeholders and help determine effective approaches and priorities for addressing litter and illegal dumping. Be it further resolved that administration explore a range of potential interventions, including behavioral messaging and infrastructure enhancements to prevent littering and illegal dumping. Be it further resolved that Council and administration assess the potential benefits of enacting a dedicated bylaw to combat illegal dumping. Be it further resolved that administration seek partnership opportunities with organizations interested in supporting anti-litter initiatives, encouraging collaborative development among government, community, and industry stakeholders. Finally, be it resolved that all proposed interventions and resulting outcomes be shared publicly to support broader efforts to reduce litter and illegal dumping across the province. Thank you.
Excuse me, there's a motion on the table. Do I have a seconder? Second by Councillor Bourne. All in favor? Against? Motion carried. Go ahead. Almost like a resolution. Okay, next, the FCM board election of Councillor Patterson that was tabled from the last meeting. Councillor Patterson.
Thank you, Warden. Just briefly, the resolution, I believe I sent out again to everyone on Saturday. Basically, it's a resolution from council permitting me to let my name stand for the board of directors of the FCM at the annual meeting in Ottawa on May 29th to June 1st. And then I think the part that there is debate about, and it's not just here, it's debate about across the country actually, Be it further resolved that council assumes all costs associated with Fraser Patterson attending board of directors meetings. I do have some comments later on, which I'll address that. I know some discussion is taking place here. I know it would be awkward to word it this way, but really what they're saying is the FCM does not assume any costs for sending person to the board of directors. So, I mean, that would be an awkward way of putting it. But anyway, I just, yeah, okay, I'm moving that resolution.
The resolution.
Sorry,
Pardon, I didn't hear. what you-
I'm moving the resolution.
Okay.
Question?
No one needs a seconder.
I think, yeah, that's what I'm getting to.
Okay.
We need a second to have it on the table for discussion.
I'll second it then.
Second by Councillor Kerr, called for discussion.
Have a question?
Yeah, how many times a year are you meeting?
Sorry?
How many times a year are you meeting?
3 times, Jess, a good question. They meet actually 4 counting the annual meeting, but the board meets 3 times. Once in Ottawa for advocacy days where they meet with MPs and senators. And then 2 other times anywhere in the country. Last year it happened to be Ottawa and Montreal. Traditionally, in the last 4 years, I've only attended 2 of those in person because they're hybrid meetings. Okay, so that's that. But if I could just run through this briefly, and I neglected last time to put this together, but it's really a 3-step process. It's not, you know, by council approving this motion does not mean by a long shot that I'm on the board. All you're allowing is not, basically you're nominating me. So that, a similar resolution like this has been, in my time, presented to council 6 times. The first one was former Warden Morrison, who was elected to the board of the FCM. I forget the year. Things get hazy back there. In 2017, I received approval to let my name stand. I wasn't successful in that election. In 21 and 22, I received approval to serve on committees. And in 23 and 24, I received approval to serve on the board. I was elected. The term expires in June. Again, I kind of added this part in, you know, it's not inconceivable. It's not beyond the realm of possibility that someone around a council table in Victoria County, 7,000 people, could be president of the FCM. That is a possibility. That's all I'm saying. I'm just talking to the Nordic people, ski people. There are possibilities, right? So I guess my take on it is, I would hate to see some future person sitting around this table not be given that opportunity. Secondly is the election, which takes place at the FCM AGM. There's 4 representatives from Nova Scotia. One is the president of the NSFM, Mayor Pam Mood, representative from HRM, and 2 that are elected province-wide. And the 2 times I was elected, that's what happened. Step 3, come back to council again, and our policy requires permission or approval for out of province travel. So that's where council, what Councillor Kerr just asked, that's where that discussion could take place. In the past, I've attended 2 out of 3 meetings. I understand that it is taxpayers' money, and I'm willing to explore different options. Deputy Warden McLeod has mentioned a couple of times a cap. Some people do have a cap. They have a certain amount they can spend on conferences and so on. And then it's up to them if they want to go to pay either all of the rest or a portion of the rest out of their own pocket. Finally, the intangible things, and these are the ones you can't measure, but this one I can measure because another board member went to ski Cape Smoky this winter, rented 4 cabins, spent 2 days skiing, and I asked her, why did you go to ski Cape Smoky? Well, you kept talking about it so much, I just had to see it for myself. you know, and those intangible things, I do, believe it or not, promote Ross Ferry, Victoria County, and Cape Breton Island to even sometimes people who won't listen. They don't want to listen. But anyway, and I think that's part of it. Even this morning with this North Nordic ski, the experience I had in Prince George, I'm going to look up my contacts and they can contact someone there to, you know, those are the things that they're intangible, like I said, but you don't know what effect might come of them, I guess, by just meeting these people. Anyway, thank you.
Councillor Matheson-LeFort.
Has anyone on the council, have you ran against anyone on the council before for this position? Like, have any more than one person submit, like, or want to go for that position before? Yes. Oh, I'm just curious. Thank you for that.
Nobody has ran against you.
Nobody ran against you? Maybe you need someone to run against you.
Your name forward?
Maybe sometimes. I mean, you're selling it, so I mean, I might buy what you're selling. That's all I'm saying.
But
Thank you.
you're a lot younger than I am, so you'll have an opportunity to do that in the future. Believe it or not, I won't be here forever.
Thank you, Councilor Patterson.
Okay. Councillor Kerr.
Just a point of clarification for what this motion is basically doing is giving you the right to put your name up. The financial end of it will be decided after the fact. Okay.
Because I lose.
Yeah, it's immaterial. Yeah. Yeah.
So we will decide if you get elected, we will decide financial or either have meetings in virtual meetings, right? Oh, yeah.
Thank you, Deputy. As Councillor Kerr said, that as we know, that has to come back to council, approval of other province travel. So that's when we'll have the debate. Okay, as Councillor Kerr asked earlier, how many meetings do you want to go to? Do you want to pay part of it yourself? I mean, all those discussions will take place if I get elected, as you said. Yeah.
Okay.
Okay, it's been motioned and moved to second that.
So the motion will be just to approve to the Council Patterson put his name
Forward. And financial, if he is successful, financial will be discussed later.
Yeah, it's not approved. It's just discussed.
Just discussed.
Correct.
Okay.
Yeah.
So all in favor?
Okay.
Against? Motion carried. You can put your name forward.
Thank you, Warden, and thank you, Council, for the faith you put in me. It gives you a whole new perspective, I think, on municipal government when you look at different provinces, how they do things, and so on and so forth. And I've always said before, like sitting here with 8 of us, there's all kinds of people in the background that are doing the same thing. So thank you again for your confidence in me.
Hey, thank you. Next is first reading of the BYLAW repeals. Okay, so I have it in front of me here as the Council Municipality of the County of Victoria has undertaken review by certain bylaws, and this bylaw shall be known as cited as the bylaw repeal certain bylaws. And the ones that are being repealed are the auctioneers, peddlers, hawkers, and trader of goods bylaw 1982, building permit fees bylaw 2010, 2020 electronic voting bylaw 2020, external organization tax exemption bylaw 2014, and the smoking bylaw for 2002. That's the motion on the floor. Do I have a seconder to repeal these motions? Seconder by Councillor Matheson-LeFort. All in favor?
Aye.
Oh, I did. So all in favor of these being repealed? Against? Motion carried. The next one is the first reading of the Land Use and Municipal Planning Standards Bylaw. So I make a motion that the reading of the Land Use Municipal Planning Standards Bylaw be put forward. Do I have a seconder? Go. Strategy? Okay. Table. Thank you, Councillor Bourne. Can I have a seconder for that? Second by Councillor Bourne. All in favor? Against? Motion carried. Ooh, again. Yeah. No, we're going to the bylaw, the budget. It's not in there. I'm doing that after the budget one. Okay. The next, we had a audit committee meeting this morning, and we need to put a motion in for the 2025-2026 budget. Yeah, I've got them in front of me here. So I'm going to move. Oh. And then read them, right? So do we have to accept the recommendations from the audit committee? And I'm going to read them and then we'll approve after each one, okay? So I move. Residential and resource tax rates of $1.15 per $100 of assessment, and commercial tax rate of $2.09 per $100 of assessment. That's the motion. Do I have a seconder? Second by Councillor Kerr. All in favor? Against? Motion is carried. Second one, move the recommendation to approve Victoria County's operating budget for the fiscal 2025-26 with revenues of $15,560,858 and expenses of $15,560,858. Can I get a seconder? Second by Councillor Matheson-LeFort. All in favor? Against? Motion carried. Recommendation to approve Victoria County's 5-year capital budget for the fiscal 2025-26 year of $23,659,260. Can I have a seconder? Second by Councillor Hennick. All in favor? Motion carried. The next thing that was going to be on here was our water utility accounts discussion by our CAO, and we are moving that to the COW meeting. So we'll move right along into committee reports. Anyone have anything for their committee reports? I have a couple questions for the CAO. The meeting in English with the wastewater, if you want to comment a little bit on that.
Yep. So we had a meeting on Wednesday in Ingonish, which was requested by the fishermen in the area. We had about 8 fishermen in attendance and a couple of other representatives there, along with the councillor for the area. Straight Engineering led the meeting. They received some more questions, and unfortunately Dylan was online and sometimes the questions didn't get heard completely. It was not the best setup that was there. However, they will be bringing back answers to the questions. There was questions about the temperature of the water. There was questions about the outflow, concerns in relation to those things. And we also let them know about the Engage Victoria County website that we are developing, which will have all documents and FAQs in relation to this project. We also requested that anyone who is in the proposed area for connection to the new system, that they answer their survey, and the surveys will determine within the budget and the most positive answers of where the system will go within the budgeted amount. So please, if you have received a survey, you should have received it. They were sent out at least a week ago, 2 weeks ago. So the surveys are out there. If you are between the Smoky Development and the Celtic Lodge, you would be considered to be in that system. If you have not received it, please contact our office.
That was the next thing up in your survey. I just had a question. Do we get any quotes for the Code of Conduct Investigator Group?
Not yet. We've only been able to get a hold of one of them. I'm assuming that most are going to be about the same, their prices. And I think that it really depends on what the Code of Conduct investigation is going to be related to. I think we should maybe go forward with the group that answered the call on our behalf.
That's it for me. Anyone else have any questions for our CAO? Councillor Bourne?
Just one question with the meeting with Minister Boudreau in relation to Victoria County's interest in being part of alternative energy. Discuss some wind projects. Do you have anything to share?
Not quite at this point.
Okay.
No. Just that we have an interest.
Yes. Okay. Correspondence. Any correspondence?
Yeah, that's all been forwarded to you, but just a note that I did, and I believe you also maybe received a note, or it would have been in your council package, that Minister Lohr has given us another extension on the land use bylaw minimum planning strategy.